really low. But if I look, here I can see out here some kind of renal capsule there. Here is mostly going to be cortex. And how will I know that this is cortex? What will I see here that I don't see anyplace else?
Glands.
What are these? Renal corpuscles. And the corpuscles, of course, are made up of what and what? Glomerulus and Bowman's capsule. Yep. And then as I go deeper into the medulla, I'm going to remember the medulla is going to have the ends of the loops of Henle. So here's some loops of Henle, and it's going to have collecting ducts. And by the time I get to about here, all I'm seeing are collecting ducts. So all of the tubes are kind of running in the same direction. And then somewhere down here, they're all going to kind of come together, and they're going to leave really what's the kidney and go into the pelvis, which connects to the ureter. So here would be the papilla of the pyramid in the medulla, right here, right? The urine will leave here, it'll go into the space, and remember, the space is created by the pelvis. And when we did the dissection of the gross kidney, remember, it was kind of like a little, like an envelope there, right? With an opening at the bottom for the ureter. Sometimes when we look at this, so here's kind of where that's coming out at the hilus or hilum of the kidney. So here's where the indentation would be. We might expect to see some renal arteries and veins. Artery here or vein? Vein. This would probably be artery. Good. And then sometimes if we go out, we even get to see a little bit of a tube like this. And since we're here, let's go ahead and look at that. Okay, so I'm going to take that up to... Okay. By the way, what is all this stuff? Adipose. Okay, let's go up to the next. Let's go up to high power. So if I look at this guy, right next to the lumen, what kind of epithelium am I seeing? It is stratified, but it's not a stratified something. Look at these cells right here. It is transitional. So what would be a tube that has transitional epithelium that's right next to the kidney? So that's going to be my ureter. Okay? All right. Questions about that? So let's go back to an area of the cortex where we can see interesting stuff. And so I'm going to go up to at least low power, and then I'll probably go up to high power as well. So can you see that all right? All right, so again, these were the renal corpuscles, and you told me they were made up of a glomerulus and a Bowman's capsule. So I'm going to actually go up to high power. Let's look at this a little more closely. There's one. All right, so the stuff that's in the middle here is going to be what? That's a glomerulus. And then the white space that we're seeing here is going to be probably, that's the space around the Bowman's capsule. So the parietal layer of Bowman's capsule is going to be around the outside here. The visceral layer, remember, sits right on top of the glomerulus. All right? Then, here you can actually see that capsular space kind of leading away. This is probably going to be a proximal convoluted tubule. But it's difficult to tell because oftentimes they're twisted. So if I look over here, I can see a whole bunch of convoluted tubules. Some of them are going to be proximal, some of them are going to be distal. If we could tell, what would we use to tell proximal from distal? Microvilli. Which ones have them? Proximal. Okay? So on a lab test though, any of these things, so if I put the pointer on this thing right here, convoluted tubule. If you wanted to write proximal or distal convoluted tubule, you certainly could do that, but we're not going to worry about differentiating them. Okay? Some of them are in cross section, some of them are in longitudinal section, some of them are in kind of an oblique section. Doesn't matter, they're all convoluted tubules there. Okay, The last thing we want to see if we can find would be the afferent and efferent arterioles. And so how would we tell the difference between an afferent and an efferent arteriole? Size or
Color then?
maybe not color. How about blood flow? Which way the blood flows, right? So afferent arteriole, the blood flows how? Into, and the efferent it flows out of. Okay, so I picked this little spot right here because when I'm looking for an arteriole, by the way, I'm not going to be able to tell if they're afferent or efferent because first of all, I'm probably not going to have both of them there to compare size. And second of all, this is a static thing, so I can't see which way the blood is flowing. So arteriole, if you wanted to put afferent or efferent arteriole, that works as well. I'm going to look for something that's the same color and texture as my glomerulus. So check out my glomerulus here. See this? That's a really long one. Usually you don't see them that long. That would be an arteriole coming off. Okay? All right, so I'm just going to see if I can find any others. So on this one, this is more typical. See, you see just a little piece of it. Where's the rest of it? Out of the plane of the cut. All right? Here I can see a bunch of blood cells. I don't know what that is. That could be one of those, you know, remember we had a whole series of branching blood vessels that came into and went out of the kidney. It's probably one of those. We don't have to identify them. Seeing if I see anything. The first one we saw was probably the best one in terms of the size that we have. This one might have a little bit coming out here. See it? So I'm going to again look for color and texture that kind of matches what my glomerulus has. So again, coming in out here. All right? Good? Okay. Ways to differentiate one tube from another. All right? So in the urinary system, we really just have one tube. How are you going to tell this tube from all the rest of them? Transitional epithelium, absolutely. So none of the rest of the tube should have transitional epithelium. So if we go up to a little higher power on this one, this is under high power now, you can see the transitional epithelium really nicely there as part of the mucosa, right? And then if I look underneath it, what am I going to see next? Yeah, I'm going to have smooth muscle. How many layers of smooth muscle should I have? I should have 2. And these ones, remember, are a little different, especially if you're looking kind of in the middle of the ureter. So we're going to have a longitudinal layer, and then we're going to have a circular layer. Normally we have circular and then longitudinal, so this is kind of backwards. And then as we go out a little further, we'll have the adventitious serosity kind of thing. Okay, connective tissue. Any questions about that? So this would be a nice view. You can see all the layers right here. So again, here's my mucosa layer with my transitional epithelium. This is going to be my muscularis layer right here with a longitudinal and then a circular layer. And then out here, that's going to be my adventitious layer. Transitional epithelium again. So if I just kind of scan through this slide here, I can see there's a whole bunch of different crap on here. Most of it, though, is going to be the same thing. So this is going to be the lumen of my bladder. I'm going to have not the entire thing, but a little chunk through the bladder, so it sort of ends there, sort of a little piece of the bladder wall, and then it ends over here. Why, if this is my transitional epithelium, and it is, how come I have more transitional epithelium down here? Why does that look so weird? Why do I have all that transitional epithelium? Rugae, yeah. So this is very convoluted because I have those big folds in the bladder, right? All right, so let's do this. Let's go to a place where it's not so crazy folded. So I'm going to go down here, and we'll just kind of work our way across the slide this way, all right? So again, if we look right next to the lumen, what kind of oops, what kind of tissue should we find? That's not working, what's going on here? Next to the lumen, so if I look at the epithelium here, this is gonna be transitional. This one doesn't look nearly as thick as it did on the ureter, if you look at it. It's only like this thick, but still multiple layers, and the ones that are right next to the lumen are kind of roundish or balloon shaped there, okay? Then what are we gonna see next to that?
Muscles.
Yeah, so all of this stuff that we're seeing here is going to be what?
The detrusor.
Yeah, the detrusor muscle. And so if I look at it, I mean, this stuff is going in all kinds of directions. So remember, when we're looking at the detrusor, this is kind of sort of randomly oriented muscle fibers that are going in all directions. Because when these guys contract, they're gonna make that whole bladder just collapse all at once. And then way out here in the back, we will see what? So we have a mucosa,
Oh, adventitia.
muscularis, adventitia. Yeah. Alrighty? Questions about that? And it is going to look like a bunch of tubes, right? So we have lots of slides that have a bunch of tubes. What makes this one different right away when I look at it is that there are multiple tubes, right? So instead of just having like one single loop through, the ones that have single loops are gonna be what? The urethra, vas deferens, fallopian tube, right? The testes and the epididymis are both gonna have multiple tubes in there. So we should be able to tell the difference that way. Now we just have to figure out if this is testes or epididymis. I already told you the answer, but we'll look as we're going through it. Here, I'm gonna have a covering over the testes, so that's probably gonna be what?
Tunica.
It could be, but it's probably the inner one. Albuginea, yeah, probably the tunica albuginea. Now remember, in human testes, because they're bigger, the albuginea makes those little depressions in and separates the testes into kind of lobes or segments. And so they have septa. The little mouse testes don't have any. So if I just look through here, I don't see anything that looks like I'm really dividing it into chunks or sections or anything like that. Okay, so no septum that we're gonna see in these guys. All right, these little tubes are gonna be cross sections through what?
Seminiferous.
Yeah, seminiferous tubules. And why do we care about seminiferous tubules? What do we do there?
Make sperm.
We're gonna make sperm. Okay, so let's take a look at seminiferous tubule up close and personal. See if we can find one that has a lumen that looks nice. Not that, and one of a nice round one. Alright, well anyway, let's go with this. Now let's find a bigger one, better one. In the seminiferous tubules, most of these cells here are gonna be what?
Spermatogenesis.
Yeah, so some kind of cell on its way to becoming a sperm, right? So a spermatogenic cell would be sort of the generic term. So out here we might expect to see spermatogonia, primary spermatocytes, secondary spermatocytes, and then by the time we get in here, if we find some that have tails, and oftentimes when you look at the middle, you'll find them with tails, these are gonna be what? Yeah, probably spermatozoa if they have tails, right? Okay, so they're undergoing spermiogenesis there, all right? Around the outside, we'll find some little cells that are kind of smooth, muscly-like. Anybody remember what those are called? No? These guys are gonna be the interstitial probably here, in between the seminal vesicles. I mean seminiferous tubule, sorry. What were the cells that are around these called? Myeloid cells, remember those? I don't think they're on your lab manual, but. Okay, interstitial cells are here in between the seminiferous tubules. What did they make? Testosterone. All right, anything else we need to know about the testes?
We're gonna call all those cells sperm cells.
We'll call them spermatogenic
You want-
cells.
Okay.
Yeah. I would say spermatogenic. Slide with the testes, you can also see the epididymis, but when I was looking around quick, I didn't see one on that one, so let's pull up an epididymis slide. What do you notice that's different right away? What's different right away?
Very clear definition. The
What's
wall, the very clear definition between the wall and sperm.
Yeah, right, exactly. So we're gonna have, these are the sperm that are in the middle here. They're very distinct looking, they're separate from the wall, okay? How about the wall itself? What's different here?
Pseudostratified column.
Yeah, it's supposed to be pseudostratified columnar. Some of these almost look like regular columnar cells, but they're supposed to be pseudostratified. In any case, you can see that they're tall cells. Like here's where the nucleus is, and look at how much cytoplasm's on top. When you look at the testes, you don't see columnar cells. You just see those spermatogenic cells that basically look kind of round. So that's really different. And then, so here would be one loop through an epididymis. This would be a loop through on another segment of it. And then in between them, what are we going to see? What kind of cells? In there. So you can see them kind of here. Here. Somebody's whispering it, I can tell. Starts with an S. Smooth muscle, yeah, smooth muscle. What's this?
Blood vessel?
Yeah, it is a blood vessel. What's this?
Another blood vessel?
Another blood vessel. Good. What else are we supposed to find on here?
Blood, but the other vessel.
Sometimes, if you are looking at the right slide, you go on scanning power, and you just kind of look around a little bit, you may find some really big blood vessels that are kind of on the side of the slide. But not so much on this one. So there we are. Okay, but what will be different for sure? The epithelium. Yep, so we're not gonna have transitional epithelium. The other thing that you might notice here is look at all of this stuff. What do you suppose this stuff might be? There's some connective tissue there.
Blood vessels?
Blood vessels,
Artery?
maybe arteries, veins, nerves. What is that probably? Spermatic cord, very good. All right, so let's look at the tube itself up close and personal. So what kind of epithelium are we supposed to see on here? Pseudostratified. This definitely looks pseudostratified to me, don't you think? Multiple fake looking layers, definitely tall cells here, right? And then what else should we see on the vas deferens?
Smooth muscle?
Yeah, so if we look, there's muscle layer in here. This muscle is pretty distinct looking. This stuff, maybe not so much. And then if we get out far enough, what would this be?
Adventitia?
Yeah. Okay? So again, here's gonna be our mucosa layer. We got some messy looking muscularis stuff there, and then our adventitia layer up there. Okay? Here's one of those blood vessels, part of the, maybe part of the spermatic cord. I don't see anything that looks like a nerve there. Oh, well. So, I'm gonna start and I'm gonna look for different kinds of follicles. Now, partly I might be able to tell what kind of follicle it is by looking at its size, right? So if I have really big giant ones like this, I'm gonna guess that they're probably what kind of follicle? Yeah, probably mature. Now, if you're looking at this one, you're like, well, how can that be a mature follicle? I don't see an egg, I don't see a corona radiata, anything like that. Remember, these are three-dimensional structures. So if my egg is sitting at the top of my follicle, and I cut through the center, I'm not gonna see it, right? All I'm gonna see is a big giant antrum. Likewise, if I look at this guy right here, and I go, well, this is way smaller, it must not be a mature follicle, I could be wrong, and in this case I probably am, because I think what we're seeing in that box right there is, okay, here's my follicle, the egg's sitting at the top. I probably cut through right near the top. And I think that because I think that these cells that I'm seeing right here are actually part of the follicle wall. All right, so again, this is one of those exercises where you have to kind of use your spatial visualization skills to try to figure out what's what. I'm gonna guess that these two things did pretty much the same thing. This one is maybe a nice one to look at as a mature follicle, because I think it has all the parts that we want to see. All right, so these cells around the outside, what would we call those? What was that? Granulosa cells. So that's the follicle wall there. The white in the middle is going to be what? The antrum. This pink thing that I have right here is going to be my ovum. The cells here that are attaching the ovum to the follicle wall, cumulus oophorus. And then I'm going to go up to a little bit higher power because I want to take a little bit better look at my egg here. So this one, I know Emily and Alex were looking at these earlier today, and I actually like this one better than what you guys were looking at, I think. So this is going to be the egg in here. This stuff right here is going to be what? That's the zona pellucida. So this one doesn't look quite as, I don't know, frothy as what they were looking at earlier. And then these cells out here are going to be what? Corona radiata. Yep, so this is my egg. This is my zona pellucida here. This is going to be my corona radiata. All right? Okay, now what I'm going to do is I'm going to go out of that follicle and I'm going to go over to the edge and I'm going to look for some other follicles and see what I can see. So I should be able to find primordial, primary, secondary, and we already found the tertiary. So this whole bunch of stuff that I have right here, this is a whole bunch of primordial follicles. So I'm going to kind of highlight one right there. See it? So what's this? Right here. That's the ovum. You see these little flat cells around it? Yeah, those are the pregranulosa cells that look kind of like a simple squamous epithelium. All right, so those are my primordial. If I'm going to find a primary follicle, what will be different?
Cuboidal.
Yeah, so the epithelium around it is going to look more cuboidal. So let's see if I can find one of those. There's going to be a mature one again. So again, this one looks more like what Emily and Alex were looking at earlier. So here's the egg. The zona pellucida would be in this area here. And then corona radiata and probably cumulus oophorus. I can't see the whole thing. All right, so here, this is probably a primary follicle, but this is one I clipped just the edge of. So what I'm seeing is all granulosa cells. I don't see any ovum over it. Okay. There's a really nice primary one all by itself. See where the arrow is? There.
I have a question.
Yeah.
Okay, it doesn't super pertain to this, kind of does, but, so when they like harvest women's eggs to like freeze, what?
Yeah, I would say secondary. Why would I say that? Yeah, so this would be your ovum. It's a little weird. And then here's the follicle wall. So again, multiple layers. I'm not really seeing a whole lot for an antrum yet. So that would probably indicate I'm looking at early in the secondary follicle stage. How come I can't find any primary? Like maybe this guy right here. See him? So here's my egg. Look at the cells right here. What do they look like? Cuboidal, yeah. So there would be one. Here would be another primary follicle. What's this one? Primordial. So primary, 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 primordial, primordial, and so on. All right? How are we feeling about that? Here's my whole ovary, right? And on the ovary, I can still see some follicles. So here's one right here. What would you guess this guy's going to be?
Mature.
Maybe, but maybe like late in the secondary phase. Let's bring that up a little bit higher power. And so if I say late secondary, why might I say that for this guy?
The antrum isn't something.
Yeah, it looks like it's just starting to have an antrum forming there. So this might be one that didn't make it to be a mature follicle in this particular cycle, right? Okay, if I go back to scanning power, I'm going to look for corpus luteum. So there are a bunch of primary and secondary follicles on here. I don't really see any tertiary ones because probably whatever I had for tertiary follicles ovulated, and probably the one that ovulated used to be right here. Do you see it? Yeah, so kind of a big circular dense area. So again, I had a big antrum there. When the egg burst out, the antrum collapsed. So on some of the slides, you can still see where the antrum was, and it hasn't collapsed all the way. I like these ones because they collapsed and you can just see a big dense leftover thing of tissue. Over time, this will get smaller and become scar tissue that we call the corpus albicans. But right now, that's kind of a nice corpus luteum. All right? I kind of like this slide for the other follicles that are on there. I think you can see some nice ones that we didn't really see on the other one. All right, so anyway, corpus luteum, just one. So there it is. And so how am I going to tell this one? This is under scanning power. How am I going to tell this one from the other ones?
Cilia.
Yeah, so I'm not going to be able to see cilia from scanning power. What else do I see though?
Smooth muscle.
I see a lot of smooth muscle.
Folds.
Yeah, what are these called?
Mucosal folds.
Mucosal folds. Did anybody else have mucosal folds? No. So you want to make sure that you can tell a mucosal fold from a rugae, right? But when you bring them up to a little higher power, I think they really look different, don't you?
More branch-like.
Yeah. Let's go up to even higher power. So what kind of epithelium am I going to see on these?
Ciliated columnar.
Yeah. So if I look at these, definitely can see the cilia, definitely columnar cells, right? So they look a little different. All right. And so I'm going to see nice kind of mucosa with a little lamina propria underneath that. As I get out into the wall of the fallopian tube, what's all this stuff going to be?
Smooth muscle.
Smooth muscle. And then at the end, I'll see adventitia. Okay, what's that thing in the middle right there? Yeah, probably a vein. Okay. Anything else we need to see on here? All right. Then the last slide that I'm going to show you is going to be the mature uterus. Look at the immature one too, but the mature one is much more interesting, so I'm going to show you that baby instead of the immature. But you'll look at them and compare them when you're done. So, how many layers to the uterus? How many? 3, okay? So I'm going to have one layer that goes from here to the lumen. I'm going to have one layer that goes sort of from here to the first layer. And then I'm going to have one little teeny tiny layer out here. What's the teeny tiny one out here called? Perimetrium. What's the one that's here? Myometrium. And what's this one? Endometrium. So in the endometrium, how many layers do I have? 2. Okay? So I'm going to have kind of this part here, and then I'm going to have kind of this part here. What's this part?
Functional.
Functionalis. What's this part? Basalis. So where does one end and the next begin? I don't know, kind of in this area here. If I put the pointer here, you're going to say basalis. If I put it here, you're going to say functionalis. What are these whole things?
Yuckies.
Glands, yeah, probably glands, there's probably some spiral arteries in there. This is a newer one of the slides. If you look at some of the older one of the slides, you can actually see the increased blood area in the lower part of the spiral arteries because it looks kind of a rust color. This particular slide doesn't stain quite as well that way, so I don't notice the blood like I do in the other one. All right, how many muscle layers? 3, just like what other organ we know of?
Stomach.
The stomach, yep. So if you look here, we got 1, 2, 3 layers. And then out here's the perimeter. I wanted to show you this because this looks kind of cool here. So when I was asking you what those structures were, look at it under high power. What kind of epithelium do you see there?
Columnar.
Yeah, it actually is more of a cuboidal epithelium, big round centrally located nuclei, which is what you find in the ducts of glands, and glands themselves.